Afternoon to everyone, and thank you so much for all you do to assist public health everywhere as we continue to fight this global pandemic. Again, Rod Jenkins, Public Health Director for Durham County. Delighted to have with me members of the North Carolina National Guard, who not only in Durham, but throughout the state has provided assistance with our COVID relief efforts through vaccination, data entry, and just administrative support. As a former Guard member in South Carolina, I definitely know the sacrifices that they're making, and I express my gratitude to each and every one of them. Happy to have 12 Guardsmen with Durham County at present. Came this week and hit the ground running, and we're certainly delighted to have them as we multiply our force. Again, I just want to reiterate to the general viewing population that we still have a raging pandemic ahead of us. And, although there's some light at the end of the tunnel, we still have a lot of work to do in terms of, continuing to protect ourselves and exercising those public health mitigation strategies. And I implore everyone under the sound of my voice to double down on the 3 W's, which of course everyone knows is wear your mask whenever you're outside of your household, wash your hands vigorously, and social distance by waiting 6 feet. I would also add that we should do our best to avoid large gatherings, primarily because we do have new variants. And although it's not necessarily been reported in the state of North Carolina is a state in which there's frequent travelers, and particularly in the Triangle. So just know that our state Department of Public Health and your local health departments are on the lookout for that. At present in Durham, we have 1,246 active cases, 17,019 inactive or discharge cases. The number of deaths have increased, as you would imagine, with sustained levels of COVID surge. Increased hospitalizations will definitely require increased deaths. Our hearts, prayers are always with those who have lost loved ones to COVID. Total numbers of COVID infections since the pandemic began is 18,449 total cases. Durham County has been hard at work to really fix some things that unfortunately went wrong in terms of technical glitches as it related to our hotline. Again, we are thankful for the patience that our residents exercise when trying to get in, and still exercise when trying to get in. But again, we have rectified the situation by employing a self-scheduling application. We have also increased our technology on our COVID vaccination line by allowing a queuing hold function in order to ensure that we improve our customer service. And again, we have also done all that we can to increase our bandwidth by having more and more personnel on the phone lines to take those calls. We believe in having an equitable approach, and we know that everyone does not have access to internet or computers, so we wanted to make sure that we had a telephone line dedicated and available. And we've also made a lot of our scheduling apparatus available in both English and Spanish. So, again, a lot of work to be done. A lot has happened since Durham entered phase 2, which was effective on January the 19th. And without further ado, I'll just go ahead and start answering some of the questions. Oh, I apologize. We'll turn it over to Staff Sergeant Shafer for some introductions.
Thank you, Mr. Jenkins. I appreciate the intro and the opportunity to answer questions that anyone might have. One of the questions that was brought to me was what impact do all National Guard members expect to have on the pace of the vaccine rollout in Durham? And do we have any tangible goals, i.e. hoping to increase volume of administration numbers by a percentage point? Of course, obviously, we expect to have a positive impact working with our civilian partners here in Durham. Of course, it's early. My team's been on the ground for approximately 2 days, with really yesterday being the real test, hitting the ground running, doing what we do administratively, and of course, administering vaccines with our civilian partners. The early numbers now show anywhere between a 10 to 18% impact from the strike team here in Durham. And as far as tangible goals to increase that percentage, it's still kind of early, but we are optimistic. And as the data continues to come in, we'll know more. We'll know more how to project what our impact will be for Durham County. All right. And then, of course, the other question that I received was how long we expect to be in Durham, and will our teams help administer vaccines at other Durham sites? The National Guard has had a long history of working with the civilian population and the state and our civilian partners. From my perspective, as a team leader, I expect my team to be here for as long as our civilian partners require us to be here. We are here to serve them and serve the community, and to overall serve the state of North Carolina. As far as other sites go, should our civilian partners and DHHS decide that they would like to have us help out at another site, we are, of course, trained and ready to respond to those requests at a moment's notice. Good. All right. And the last question that I received was, what are you most looking forward to in your partnership with the health department, and what do you anticipate may be the upcoming challenges? The thing that we always look forward to when we're working with other entities in the state is, of course, new and renewed relationships that we've had with our civilian partners. And in this case, for me, this being kind of a new experience working with Durham County, I most look forward to creating the working relationships with individuals like Mr. Jenkins and other people here that are on site doing the hard work, so that in the future we have these relationships in place and these lines of communications in place, so that should we be called again, we can respond even quicker and better than we did the last time. And any challenges that we may have, I mean, like I said, it's kind of early. We've had some technical challenges in terms of working with new programs, new internet and web-based programs and things like that. My team has done an outstanding job of being able to push through those technical issues. As far as logistics go and things like that, the National Guard we've all been long, trained and ready to respond to whatever requests the state may have for us. So any challenges that come up are easily overcome and adapted to respond as effectively and as quickly as we can. And I'll hand it over to Lieutenant Colonel Devivo, who will have some more information and be able to answer some more questions for you.
Thank you, Sergeant Shafer. On behalf of Major General Hunt, the Adjutant General of North Carolina, thank you for having myself and Sergeant Shafer on. The big picture, as you know, Governor Cooper has mobilized approximately 250 soldiers and airmen to support the vaccination operations across our state. And currently there are 11 vaccination teams and 15 administrative teams. Each team consists of 6 personnel. In Durham, there are 12, an admin team and a vaccination team, and from all sounds of it, from Director Jenkins on down, the team's integrated and fit right into their operation, and we're very proud of what they're doing. Some counties have multiple administrative teams. We found that was actually one of the larger demands. They wanted extra folks to help with the administrative tasks that happen around a healthcare facility. So when we started this about 2 weeks ago, we had 2 teams in Winston-Salem, 2 teams in Elizabeth City, and that was the test bed. And from there, we found some strengths and weaknesses, and we're able to modify our teams. And Sergeant Shafer and his team are the example of that hard work and partnership with everyone from Health and Human Services to the county level, with our division partners in emergency management and the Department of Public Safety. So it's a whole of government approach. We're just another piece of that. And it's just a great example, again, of what our citizen soldiers and airmen can do when asked. No one would ever thought a few years ago we'd be shooting vaccines into people's arms. We're used to hurricanes and winter storms and going overseas to combat zones. But this is the versatility and the strength of our great North Carolinians. They're working in the communities where they live. They obviously, as you know, that you can get along with them. They're just like you. They want to help our citizens. So we're here, we're ready, we're reliable, and we'll continue to support Durham until the demand says they're not needed anymore. So one other thing is just to thank the families of Guardsmen and the employers, because most of these folks are stopping their civilian careers and coming on to duty to help their fellow citizens. So the selfless service is just exemplary, and healthcare workers are the same. They've been working hard since March, and so we're right alongside our healthcare workers and everyone else to make sure we get as many vaccines out there to the public. And so thank you, Director Jenkins, for having me on.
And again, I will say how much in gratitude we are to the National Guard. I want the viewing audience to understand that this is not their first foray with us. As I was standing by waiting, I just remembered that early in our COVID response toward the summertime, we did have National Guard members inside our Emergency Operations Center for several weeks to help us out, to really steady us and get us situated. So we're certainly appreciative of all the efforts. And as Sergeant Shafer has mentioned, they have come in and just really hit the ground running. It's like they've been a part of this team the entire time, from the team of vaccinators who just really kind of sat down at the tables, kind of understood the battle rhythm of how we were doing things, to the administrative team that really kind of dealt with the challenges we faced with some of the technology to overcome that, to really get us to a place where we're sort of like, I think the best way to say it is this is real time now. So as opposed to having a backlog or having some things undone, we are certainly at a much better place. So we look forward to that continued partnership with the Guard. And, again, I echo the sentiments. Thank you to the employers and the families who are, willing to sacrifice their time to be here and allow us to, utilize their resources. I will continue to answer a couple of questions. The first one I received was, how many people ages 65 and older have been vaccinated so far? And at present, as of 1/15, since Monday, we have vaccinated 650 of our residents at the Durham County Department of Public Health. Unfortunately, I don't have the figures or the statistics for who all have been vaccinated at our Southern high school site, but I'm more than sure that number has increased dramatically because they are increasing their throughput every single day. So we're grateful for that partnership that we have with Duke and also with the Durham Public Schools for allowing us to utilize the site, and we expect great things to come. And for clarity, it's just we've done 650 just for those residents who are 65 years and older. Just want to make sure I'm clear. The next question: how many vaccines is Durham County able to distribute per day? How many vaccines is the health department specifically distributing? As a county, it's a little hard to determine because as a county, we're talking all of Duke, we're talking the Durham County Department of Public Health, but I'm willing to say that, you know, it's thousands collectively. We are definitely distributing thousands. And all of it is really dependent upon our vaccine allocation from the state. At Durham Public Health, we are most confident that our throughput of being able to administer vaccine is well over 6,000 per week. And we have communicated that to the state, and we have really petitioned for enough vaccine to be able to accomplish this. And with this 6,000 number, we're talking first and second doses. The next question, how far out are the appointments booked? Is Durham County having to bring in extra people to help book appointments and distribute the vaccines? Appointments at present, as of January 22nd, are booked out until the middle of April, specifically around April 15th. We are doing our best to comb through it. Again, to the listening audience, I will reiterate that everything is really dependent upon our vaccine allocation from the state. We have brought in, we've not really brought in any other resources. We have rededicated public health staff to help with booking appointments. And we do have enough individuals to manage the demand, and they're doing a fantastic job. I'm so grateful for our public health staff and all their efforts during this vaccine allocation moment. Next question, do you have any concerns about running out of vaccine supply? If so, what will happen to the appointments already scheduled? I will say that I have grave concerns about running out of vaccine, and it does appear that that is going to be something that probably might happen. It's important to be forthright and very honest and really have the difficult conversations with the media and with the community. We have heeded the charge and the mandate from the governor, which was to exhaust all of our first dose supply by Monday, January 25th, close of business. We are in process, and we do have a plan to make sure we exhaust all of our first dose supply. Like a lot of other counties, we're not exactly sure whether or not we will receive that allocation of additional first doses, but we are doing our very best to work with the state and our partners to make sure that we have first dose vaccine supply. As the state has indicated many times before doing conference calls and different press briefings, they are have been notified by the CDC that they have to increase their throughput. And to that regard, they have challenged local health departments to do just that, exhaust their supply. At present, the state has also mandated that we are not to use second doses as first doses. So unfortunately, again, we run the risk of having second doses on shelves. However, we can't use that as first doses. Complicated at best, but nevertheless, these are the instructions that we've received. So yes, there is concern that we will not necessarily have the vaccine needed to put shots in arms per the guidelines given to us by the state. And what will happen with appointments already scheduled? We will endeavor to do all that we can to honor your appointments. If it means pushing it back a week, if it means notifying you immediately when vaccine becomes available, we will do our best to honor that. Our scheduling team is currently in deliberations on determining the best way forward with that. But again, it's a very fluid situation. And as we have said time and time before, everything is really contingent upon vaccine allocation. That's noted to individuals when they sign up. And we have done our best to really communicate that the state is in a unique situation in which there's only 120,000 doses to be administered through the entire state. So we're doing our best to make sure we exhaust our first dose supply in compliance with the governor's mandate. The next question, what other sites are you considering for vaccinations in Durham? There are a number of different things that are in deliberation right now. As the Secretary of Health and Human Services mentioned several Fridays ago, they are intending to stand up a mega site in Durham that will possibly have the opportunity to vaccinate anywhere from 45,000 residents per week. And that is a state-supported operation. It is my understanding that they are still working out the logistics and really planning hard to get that stood up, hopefully 1st of February. There's also additional sites that the state is considering through a number of different partners that's already in existing mode. And there are additional planning and meetings today to help stand that up. So with all that being said, nothing to announce right now, but I do know that in our partnerships with the state, our partnerships with Duke, there's a number of things that we are trying to consider to have more avenues to approach for our residents to get vaccinations. Next question, I saw that the Public Health Department is reaching out to other county government departments to see if they can recruit volunteers to help with COVID-19 vaccinations. And they'd like more information about that. I'm not exactly sure where that information came from, but we have not reached out to other county government departments to see if they can recruit volunteers. We have been fortunate to have the National Guard to help us. We have been fortunate to request assets from state emergency management, and it's my understanding that that has been fulfilled, and those additional assets are on the way, hopefully as early as next week. We've not had to ask other departments to assist us. Next question, what are the biggest challenges the Durham County Health Department is facing in distributing these vaccines? Is there anything that needs to be done to make the process go smoother? I do acknowledge that, the general public did feel as if we did not move into the next phase as quickly as we should. And I will acknowledge that we took our time to move into phase 2. I'm glad that we did, because they kind of changed the parameters and incorporated, went from 75 and older to 65 and older. So that gave us time to pivot correctly. The seniors that have come in for their vaccinations have been nothing but pleased. They have been complimentary of not only the National Guard, but they have been complimentary of staff. And we've received favorable comments about the operation and how caring the staff has been to their needs. There's a lot of fear of the vaccine, and we had endeavored in our planning to create a warm and friendly environment, free of fear, very accommodating for our seniors and everyone else. And I say so far, the mission has been accomplished. The main thing that, the main challenge that we fear is vaccine. We have worked tirelessly, long hours to stand up an operation that has the potential to vaccinate many of our residents on a daily basis. Yesterday, we were able to vaccinate 720 individuals just at the Health and Human Services building alone. That does not count what was done at Southern High School. So we have the potential to vaccinate many individuals, but if we don't have the vaccine, it's tough. We currently have a waiting list. If our residents numbering, I think approaching 1,300 individuals, and the demand is there, but we just need the vaccine in order to fulfill our mission. The next question, per state data, Durham as a county has administered 41% of all doses given to them, lower than the state's average of 48%. What are those numbers for the health department specifically, and what is your explanation for them? The only thing I can say is that, again, there are differing numbers, and I think that's primarily due to the vaccine management system, which is being used to account for the vaccine distribution. As mentioned earlier in the presser, we have worked with the National Guard to get our data caught up, and I am most confident that our numbers are not reflective of the question that was asked. And I will say that we are definitely on track to get all of our first doses exhausted by close of business on Monday as mandated by the governor. Next question, will the health department consider opening Southern High School site on holidays, weekends, and for extended hours to help speed up the rollout? I will say we have been working closely with Durham Public Schools in an effort to extend those hours. We do feel as if in the future we will have those additional hours because the demand is there. I can't really speak for holidays, and I will say that that site is manned by our great partners at Duke. And again, for hours of operation and things like that, that is really up to Duke. But for the most part, they are endeavoring to not only increase throughput at that site, but also look at potential other sites for vaccine distribution. Next question. There have been concerns nationwide about ensuring the vaccine rollout is equitable. Because the Durham Health Department is asking people to either wait on hold, call dozens of times a day to get an appointment, or schedule one online, how are you ensuring equity and ensuring that people who work full-time and can't spend hours calling or do not have a computer will have equal access to the vaccine? This is an excellent question. I can honestly say that one of the tenets of Durham Public Health is to do all that we can under an equity lens, racial equity lens. I will say in the planning process to enhance our scheduling, everything that we did was to ensure that all populations will have an opportunity to schedule an appointment. We painstakingly made sure that the documentation and the website was available in both English and Spanish. We wanted to make sure that we offered extended hours on Thursday where we are open to 7 p.m. We also offered Saturday hours in which we're open from 9 to 4 for those individuals who have demanding schedules that will not allow for them to do the things that were outlined on a regular 9 to 5 basis. I will say that we do all that we can in addition to speaking to different populations, be it the African-American population, vulnerable populations, immigrant and refugee populations, about the vaccine, about ways to get vaccinated, dispelling myths. We have gone the extra mile, in my humble opinion, to continue to do this, and we will continue to do this until this pandemic is over. But we are most certainly cognizant of the challenges facing different populations, and we are steadfast in our mission to meet that. I would say final comments. Again, I will apologize for not getting to every single question, but I will say that we do have about 50 staff doing vaccine work. Our public health staff in Durham County Department of Public Health has been definitely given the all-in from me to say, hey, this is priority number one. While we are still serving our community by providing your regular public health services, make no mistake about it, COVID vaccinations are top priority for us. We do look at ways that we can continue to expand and to restructure our services to get all hands on deck. And I am pleased to say that just about every position at the Durham County Department of Public Health has contributed to our COVID vaccination efforts in some way, shape, or form, be it data analysis, be it manning the phone lines, be it being in the vaccination clinic and working these 12-hour days. So again, we are committed to making sure that we do all that we can to make sure that our community is vaccinated properly and expediently in a safe and effective manner. And I would just say, please be on the lookout for additional ways to get vaccinated. We do have ways for you all to get that information. Again, it's decopublichealth.org/COVID-19 vaccines with an S. And then, of course, you can always sign up for our email listserv, and they publish things, I think, 3 times a week. So, you know, there's lots of avenues to continue to get great information. There's our data hub, and of course, I do weekly updates on Friday to let you all know exactly what's going on. So again, I will say special thank you to Lieutenant Colonel Devivo. You know, again, I would say charge on, hard charger, from one soldier to the next, hua. And to Staff Sergeant Shafer, we thank you for your partnership. We look forward to continuing to move this thing forward. And to our viewing audience and to the members of the media, I thank you for allowing us to continue to spread the public health message, and we thank you so much for your partnership. Colonel Devivo, we just want to extend an opportunity for you to give some final comments.
Director Jenkins, thank you. Just as always, when the state needs assistance, they know they can rely on the Guard. We're ready and reliable, and we won't let our citizens down. And this is just a very important priority. But we've got about 600 guardsmen across the state doing food banks still and COVID testing. So, but vaccines are a priority, and we're going to work in Durham and in those other locations across the state. So thank you, Director Jenkins, and that's all we have. Thank you for your support.
That concludes our remarks for this presser, and we thank you so much, and we encourage you to have a safe weekend. Thank you.